This is a presentation on an autobiographical perspective of personality development and bipolar disorder for the class of Theories of Personalities PSY 615 by Vanessa Lang. In this presentation, we're going to cover the description of personality and factors, including the effects of environment, parenting, and genetics, birth order and personality, stages of personality development, genetics and personality development, and finally, bipolar disorder and effects on personality. Researchers such as Alport, Murray, and Cattell have gone ahead and created assessments in which to classify numerous personality traits. One of the assessments is called the Big Five Factor Model, which has 5 dimensions in which to list these traits. These consist of extroversion, agreeableness, conscientiousness, neuroticism, and openness, or ocean. Another assessment is the Myers-Briggs Type Indicator. This takes the Big Five Factor model and breaks it down into 4 categories. An individual taking this assessment would score either high or low in one of these categories. These consist of extroversion or introversion, sensing or intuition, thinking or feeling, and judging or perceiving. A recent personality assessment gave me a Myers-Briggs score of being INTJ. This means I scored high in introversion, intuition, thinking, and judging. According to the website, the definitions for introversion are a preference for more solitary activities, intuition, imaginative, curious, and open-minded, thinking embraces objectivity and logic, and judging is decisive and organized in planning and structure. One of the limitations of personality assessments is that it only categorizes the strongest traits and does not offer an explanation as to the development of these traits. Ways to combat this are to perform additional studies on the effects of the environment, the genetics, and the parenting. In regards to environment, theories have varied as to whether or not birth order actually affects personality. Some of the things that have been found is studies have shown that firstborns have a tendency to be less neurotic than their younger siblings. This may be due to the attention given to the firstborn, which leaves less psychological resources for the parents to provide for the rest of the siblings. This is accurate in my case as I am a middle child and I scored high on the neuroticism scale on this Myers-Briggs exam. Another issue is that the larger the age gap, the less the sibling rivalry. This is also true in my case, as I was more combative with my older and younger sibling, and their larger age gap between the two of them gave them a much more passive relationship. Ultimately, adult personality is often a crystallization of the childhood defenses. There are 3 theories of personality development by Hogan to explain this. They consist of the evolutionary, depth psychology, and interaction. The evolutionary interaction theories suggest that personality follows a biological imperative for survival and social interaction in order to develop. Depth psychology indicates that it is the experiences in childhood which shape personality along with genetics and parenting. These personality developments can be divided into 3 more sections, which develop during birth through 5 years of age, adolescence, and then finally adulthood. Genetics has been found to play the most prominent role in the development of personality. This is due to the fact that children can inherit particular personality traits from their parents. However, they can also inherit disorders that can affect personality. One of these inherited disorders is called bipolar II disorder. This affects the development of interpersonal skills, social behaviors, and occupational functioning. Patients can also exhibit a deficit in cognitive and executive functions, thereby inhibiting certain aspects of personality development and disposition. Bipolar disorder can be defined as a complex genetic order in which the core feature is a pathological disturbance in mood, ranging from extreme elation or mania to severe depression, usually accompanied by disturbances in thinking and behavior. It commonly begins during adolescence or early adulthood, and diagnosis consists of observing the symptoms such as the mood cyclings between high and low. Some of the issues that arise with having bipolar disorder is that approximately 50% attempt suicide at least once during a depressive state. Also, considering the diagnosis is of observing symptoms, the diagnosis is usually made much later in life. Treatment typically consists of a combination of psychotherapy, antipsychotics, mood stabilizers, and/or antidepressants. And with the right combination is very manageable. However, symptoms can reoccur, and approximately 75% of patients will relapse after 2 years of what is considered remission. Studies have shown that bipolar patients' personality traits differ from those with no disorder. They typically score higher in neuroticism, emotional reliance, and hysteria, and low in emotional stability, objectivity, and ego resiliency. Also, they are found to be more aggressive, suffer from more anxiety, and more guilt. Some of the personalities include a lower levels of extroversion and conscientiousness, and a lack of self-control and impulsivity. This can cause issues in social interaction, as well as their occupation, as it makes it more likely for them to have difficulty holding down a job. Personal analysis from research and semester. I found this research and this semester to be very relatable. It answered a lot of questions I had about my own personality and disposition, and I was able to link back the theories we were learning into events that I'd had in my life. Also, for the fact that I was diagnosed this past year with a mild form of bipolar 2 disorder. And that explained a lot of things. So I feel I gained quite a bit from this class, and I feel like I will continue to learn more about myself with the teachings and the guidelines from this semester.